Getting sick with COVID is about to get more expensive for a lot of Americans as most of the major health insurers tweak their rules. PCS Advisers managing partner Paul Seegert is a benefits expert. We ask him how billing on COVID cases had been handled in the beginning.
Well, it's a really interesting story. The insurers voluntarily decided to waive out-of-pocket costs for COVID treatments, especially those that got hospitalized for COVID. The reasoning behind that is the interesting part, I think. They did it voluntarily for a couple of reasons. One was that they were facing the likelihood that it would be required of them by the government, and so they preempted that and did it themselves, which then meant they could avoid, if they decided when to do it, they could decide when to stop doing it. And then the other reason for it was that they are governed by the medical loss ratio rules that came in with the Affordable Care Act that says they have to spend 85 cents of every dollar they collect in premium on a claim, and they get to keep 15 cents. And with the lockdowns that we were all subject to with COVID, people were not using their insurance. They weren't seeking care. Claims were down about 70%. So insurers were faced, by and large, with two choices. Give big fat refund checks or figure out other ways to spend this money. So it was a pretty sensible decision on their part. It was, why not do something, get some marketing out of this and do something good as opposed to just have to refund the dollars anyway.
So now things are changing in many cases. How so?
So the changes that we're seeing now is that claims levels have returned to more normal levels. So insurers don't have this excess cash piling up. So they don't have the same problem they had before. And as a result, they are sunsetting these policies of waiving out-of-pocket costs for COVID treatments and COVID hospitalizations. So now the way that will affect the consumer is that they will be subject to their deductibles, their co-insurance, their max out-of-pockets that are built into their health plans, whereas they were not before. And today, that's very possibly these Affordable Care Act plan designs that so many consumers deal with have a pretty significant out-of-pocket risk. Each year, that out-of-pocket max goes up. I think the max now this year is up over $8,000 for an individual. So it does represent, for many Americans, a pretty significant expense if they find themselves in that position.
That's benefits expert Paul Seegert at PCS Advisers.